Now we're going to talk about what's called Eustachian tube dysfunction, or in simple terms, ear pressure or ear pressure dysfunction. So these patients will complain about having a pressure sensation in the ears, or when they fly during takeoff and landing, the ears hurt a lot, or they feel like the ears are popping like this. Now, the most common cause of this is what's called the Eustachian tube disorder or Eustachian tube dysfunction. So what is a Eustachian tube? A Eustachian tube is a structure in a body that connects the ears to the back of the nose. It kind of goes something like this. The role of the tube is to take the air from the back of your nose into the ear so that air is equal on both sides of your eardrum. And if this tube is not working well, less air will go in your ears, which means a negative pressure will build up, and that will pull the eardrum in. And that pulling of that eardrum inside gives you the sensation of as if you're having pressure or pain, or as if you're underwater or speaking under a tunnel. Most patients who have this will also feel as if they are speaking in a tunnel or underwater. Now, one of the other functions of Eustachian tube is to take the excess fluid from the ears and drain it out of the back of the nose. So you can imagine that if this tube is not working well, what will happen is less air will be able to get inside your ears, which means a negative pressure buildup, which means eardrum getting pulled inwards, giving the sensation of as if your ears are plugged or having pain, and also secretions not being able to drain out. So patients with Eustachian tube dysfunction may have a childhood history of having a lot of ear infections, multiple ear infections, or they've had tubes in the ears that need to be placed. In adult life, what they will say is that when there is a weather change, or when there's a pressure change, when they're driving up and down the mountains, or they have in a flight during takeoff and landing, the ears are hurting a lot. Now, the treatment for Eustachian tube dysfunction can be divided into three parts. One is we start with medical management, which means you try to reduce the inflammation at the back of your nose to see if we can open up the opening of the Eustachian tube. How do we do that? We start with nasal saline rinse, which is basically a saltwater rinse as you're washing up the nose and the back of your nose to get all the junk out of the back of your nose. Second, which is the nasal steroids, so like Flonase, Rhinocort, Nasonex, or any of the generic nasal steroid spray. So you're trying to reduce again the inflammation at the back of the nose. And then allergy management. A lot of patients with Eustachian tube dysfunction will either have allergies or a chronic sinusitis, and both of these conditions results in a lot of postnasal dripping. That postnasal drip will then cause inflammation at the back of the nose and will cause the opening of the Eustachian tube to not function properly. So managing those underlying conditions. Now let's say the medical management does not work. The other option is surgical management. Within the surgical management, there are a few options. One is placement of tubes, or the ear tubes as it's commonly called, where we make a small incision in your eardrum, put a tiny tube in there, and that allows the air to go in from this side of the ear. Now, putting the ear tubes is temporary. In about 6 to 9 months time, the ear tube will fall off and then the process will restart. There is an FDA approved procedure called balloon dilation of Eustachian tube that has been shown in studies to work very good, about 70 to 80% response rate for patients with Eustachian tube dysfunction. It is done in the office. It can be done with patients awake or patients asleep, where the surgeon actually go in through the nose with tiny little balloons into the openings of a Eustachian tube, and then we dilate the balloon to make the openings bigger, take the balloon out, and about 3 to 4 weeks after the procedure, the opening stays open, air goes in and out of the ears, and you feel much more improvement. There are other more complex procedures that can be done in the ears, but that they have problems with hearing loss and other issues. So we won't address that at this point of time. It is a treatable thing. It can be treated. It's just that we have to diagnose it and treat it accordingly. Got it.